The whole office is just highly efficient. Everything about it is designed for efficiency. With improved efficiency comes increased productivity and decreased stress. The layout of the office has just been phenomenal. To be able to spend my time treating patients, not getting between patients, has been huge. The whole plan is just designed for efficiency. All of it adds up together to make a very productive and enjoyable experience. It's been the best thing we ever did was moving into this, designing and building this building and moving over here.
Let's take a look at a dental office anatomy. We've talked about how an office should be put together, and so let's take a look now at an office that actually has been done essentially exactly according to the principles of design. So let's begin at the beginning. The vestibule needs to be about 5 by 5, and we like to use glass. We like to use glass so that the patient always sees where they're coming and where they're going. So as we move into the waiting room, there are going to be 1.5 chairs in the waiting room per operatory in order to handle an appropriate throughput of patients throughout the day. Also, we want to have a children's area, and the children's area needs to be in full view of the front desk. So now we're going to pass from the waiting room into the more controlled area of the office, the appointment desk, as well as the corridor, the trunk corridor that leads down to the clinical area. We're going to use glass again, and this is a wonderful idea. We're using frosted glass. It offers even a greater degree of privacy to those on the other side of the door. So let's take a look. So we're moving from the waiting room into the appointment area. It's segregated from the reception and waiting room. And so we have the appointment area now, and we're moving into the trunk hallway next. To complete the public zone, we have the patient restroom here, we have a coffee bar here, and we have the consultation room immediately adjacent to the coffee bar. So we've just left the public zone. The public zone consists of the waiting room, the front desk, the patient restroom, and the consultation space. And now we're in the trunk hallway, and we're on our way to the clinical hallway and the operatories. In the clinical hallway, this is a great place for you to be able to impress your patients visually. Notice the sconces on the wall. The sconces on every rear delivery column, they create a beautiful colonnade effect all the way down the hall. And as they do that, it creates a beautiful geometry that is very pleasing to the human eye. And so we want to have a hallway that has a visual impact for our patients. Take a look at the ceiling. There are periodic coffers throughout the entire hallway that trap sound, because sound is going to bounce off the floor, go to the ceiling, and travel along the ceiling. And so we're going to be trapping the sound. So this office is actually very, very quiet during the day, because the sound is managed both from the floor and from the ceiling, and also from the banding. This is an excellent feature to have in your office in the clinical hallway. It is a stand-up consult area, and it allows the doctor to come out of the operatory, meet with the patient in the stand-up consult area, and have a conversation about the care that's just been delivered or will be delivered at a future appointment. This makes a real statement to the patient, because standing up, there's not a long conversation. That is an unspoken message that we're standing, we're talking. This is a short conversation, a short meeting. In addition, during that time, the operatory can be turned over so that the next patient can be brought into the operatory, and production can be maintained throughout the day, but every patient feels served. Here in the operatory, we have a number of features that drive productivity. There's bilateral symmetry, so that either a left-handed or a right-handed doctor can work with equal efficiency inside the room. There is flexible rear delivery used, so we're able to, again, have the left or right-handed doctor work with equal efficiency, and we're able to use four-handed passes. The ambient lighting really, really is wonderfully matched to the operating light. We want a 10-to-1 ratio between the operating light and the ambient light. And the way we're going to get that is to be using an ambient lighting overhead that is going, especially over the head of the patient, that's going to allow us to have a 10-to-1 ratio. So if the operating light is working at 2,500 foot candles, we want 250 foot candles over the head of the chair. And all we have to do is tell our architect that our overhead lighting has to produce that at the head of the chair. In sterilization, which is obviously another component to the clinical zone, we're going to have the dirty area, then the clean area, and then the sterile area. And we want to be able to drive our productivity by having a wonderful throughput of instrumentation in sterilization. So we want sterilization designed either in a clockwise or a counterclockwise fashion, going from dirty to clean to sterile, finally to storage. And we have radiography. And this is central radiography, and in this particular situation, we're looking at a cone beam unit. The cone beam unit is being used, obviously, in a very central location, but it is not on the clinical hallway. It doesn't need to be on the clinical hallway. It needs to be in the clinical zone. And the lab should be at the end of the clinical hallway, and it should be adequately sized to handle all of the equipment and all the materials and all the procedures that you're actually going to accomplish in that space. So now we're entering the staff zone. And of course, the staff zone is going to consist of the doctor's office, the doctor's restroom, the staff lounge and restroom, the mechanical room, and finally the bulk storage. This is an example of a doctor's office. Very, very, I say simple, but it's very elegant also. But it has a room for a freestanding desk and a credenza and 2 chairs. And so this would require about a 9 by 12 space. Here are the staff lockers. The staff love these lockers. They're 2 by 2. Be sure you incorporate that and a coat rack for them. And here is the staff restroom. We have an ante area with a common sink, so one staff member can be using that if necessary. And then, of course, we have the restroom, and there's another sink, and of course, the toilet. And of course, as part of the staff zone, we have the staff lounge. And in the staff lounge, we want to be sure to have space for a refrigerator, a microwave, a sink, and enough work area for the team to be able to come in and have lunch together. And with bulk storage, we're going to be able to have enough space for every doctor. And of course, remembering the metric, we want 150 feet for the first doctor in the practice, and we want 75 board feet for every other doctor in the practice. And of course, this is a continuation of the public area, but it's somewhat segregated because this is the front desk back area where they're going to be actually handling more issues that are not directly related to patients under care, but handling administrative activities for the practice. We've taken a look at every room of this wonderful office, and now we're going to have a conversation with the doctors. And we're going to begin with a conversation about stress.
I think there's a lot of wonderful architectural features, the layout of the office. I love that I can go from treatment room to treatment room in the doctor's hall here. It's very easy, very efficient. It just takes minimal time.
And do you have any thoughts about what was the biggest contribution to stress reduction in your office?
I'll say having the number of rooms that we need. If we've got a crowd going in one room, you have a toothache that calls all of a sudden, you've got a place to put them, and you're not rushing to get done with another procedure, so you can get them in that room and you can step right next door, get it done, and all the doctors are set up with what you need, so you're not running back and forth and trying to turn over rooms quicker than you would like to.
Well, we're continuing our interview with the doctors from this fantastic office, and we want to ask a very central and seminal question about productivity because, of course, that is one of the main reasons they even bothered to design and build the office. So I would ask both of you this question. What single, or maybe even more than one, design feature has helped drive productivity? And so I would start with you, Doctor, and just ask what your opinion of that is.
It's hard to say it's one thing. Certainly the architectural zones have helped. I don't spend time walking down hallways. I spend times in patient care. I love that we have the number of rooms. The whole office is just highly efficient. Everything about it is designed for efficiency. With the improved efficiency comes increased productivity and decreased stress. The layout of the office has just been phenomenal. To be able to spend my time treating patients, not getting between patients, has been huge. I like that the staff can be in the back in a highly productive environment as well. Everything they need is right there. The whole plan is just designed for efficiency. All of it adds up together to make a very productive and enjoyable experience. It's been the best thing we ever did was moving into designing and building this building and moving over here.
And Doctor, any thoughts?
Well, to add to that, I'd say the patient experience, which is what it's all about, is from the minute they pull in our parking lot, they see the beautiful building. There's plenty of parking spaces, easy to get in. You check in from the privacy there. People checking out are separate. You can talk about finances or any questions they have on a treatment plan. They get seated in a beautiful room. They don't feel like there's a lot of people coming and going, even though there are every few minutes. They're high turnover,
Right.
but you don't feel that when you're sitting in an operatory or checking in or out.
Right. Another question I would have relative to productivity, and then I would like to switch to image, is when we're talking about productivity, just in terms of percentages, how has productivity increased in the last year to year and a quarter in this office that you've been in the office now for about a year and a quarter?
Basically, in a year and a half, we've pretty much doubled the amount of dollars that we were producing before. And as we've said a number of times, it's been done in a much less stressful environment. From the time people pull up in front of this building, they see the quality materials intelligently put together. It's obviously built to last. Those are the very concepts we're trying to convey to our patients. It's been the whole system from the moment the patient arrives. The statement is quality, and the patients recognize that and are much more willing to accept treatment.
That's tremendous. And in fact, when I was looking at some of the numbers with you a little bit earlier, if I'm remembering that correctly, it was about a 98% increase in productivity in essentially a year and a half
Yes,
in this
that's
new
exactly
facility. Right. Yeah. And do you have any thoughts about just the percentage increase in productivity and why that would have been driven the way it was?
I think a lot of it is the type of patient. The patients we had before loved the new place, but we've also attracted a lot of new faces who maybe are a little bit more conscientious about aesthetics and that higher end service, not as much insurance driven. It's a lot more full fee than we had before. Not that we didn't have those, but we're attracting a little bit more like that. It's taken a few months as people, see us established and their friends have come. Now we start getting a lot more people who want that kind of service and demand it, and they're willing to pay more than a lot of people are willing to pay for certain things.
In terms of image, in terms of how patients are reacting to the aesthetics and the appearance of the office, just what has been your observation about how the patients are actually reacting? And I'm interested in patients who were existing patients in the old office and transitioned with you, as well as patients who are brand new to the facility. Has there been any difference?
Absolutely. It's amazing how many people come in here. They comment on the office, but one of the things that's really been well received is it feels very calm, very relaxing, very peaceful. The colors, the layout, the whole, the feel of the office is much more relaxed than it was before. Patients notice this. I've had a lot of patients tell me, Dr. Tholen, that I'm telling my kids, my coworkers, my family members that this is the office you just have to go see. We're delighted that they see these things, but the truth is we're still providing the wonderful service we've been providing for years, but now we're seen as the high-tech, cutting-edge providers of dentistry in this neighborhood, and all of those things just keep driving in more people. It's been amazing what we've been able to do with that.
Tremendous. And what have been your observations, Doctor, about patient statements regarding the appearance of the office?
They love it. I mean, they go on, and I think my dad touched on earlier. They trust us before, but it's almost like in spite of the facility we had, that they trusted us, but now they feel like they're a part of it, and a lot of them have been with us for 20, 30 years, sometimes 2 or 3 generations, and they feel like they're part of the progress and are glad to be a part of this practice, and they love to come. A lot of them say, ask if they can stay late and sit in the chair for a little while just because they like the view and just the feel of the office. So it's great.
I think another thing that's happened is they wouldn't really say this to us, but sometimes in our old rundown, beat up old office, they're a little bit ashamed to send somebody over there. Since we've been here and it presents the right image, they're glad to tell their friends, this is someplace you need to go. They're proud to say, this is my dentist. The image has changed, certainly.
That's tremendous. I have one last question, and this is, if you had to do it all over again, would you have done it earlier at the same time? Would you have delayed this process? And as a follow-on element to that, would you have made the office smaller, bigger or the same?
The timing came together for us when my son graduated dental school and my daughter graduated dental school. We knew we were outgrowing our old facility. For us, the timing was right, but if we had had the circumstances present themselves that it was time for a move earlier, yes, I would do it. And I would encourage anyone that's contemplating doing this. This is without a doubt the best financial decision I've ever made, with the possible exception of pursuing a dental degree. I would do this again. I would build it probably a little bit larger. By building larger, we already have a periodontist. It'd be nice to have an endodontist in here a day or two a week. It'd be nice to have an oral surgeon in here a day or two a week, and that's kind of in the long-term plan. As I start to cut back my hours at age 64, I have no regrets doing it at this stage of my life. In fact, I think it is something that will allow me to retire from dentistry or phase out from dentistry a little bit younger than if I had never done it. But I certainly have set the kids up in a wonderful position, and without them here, this would never have happened either. So I would do it sooner if the opportunity had presented itself.
All right, all right. And Doctor, any thoughts? Any additional thoughts?
I agree. I'm glad it's done now, and you always wish you could have started it sooner. But like you said, the circumstances had to be there. But it's amazing when we moved, we thought we were never going to fill it up, and now a year later, we're sometimes looking for more rooms, which is a blessing. But you fill up what you got, and it's amazing that it only took a year, and you could use 2 or 3 more rooms.
Wow.
Thank you for your role in this. You've been a wonderful help and a wonderful advisor. Thank you, Dr. Tholen.
Thank you.
Thank you.
Thank you, Doctor.
Sir.
So we're continuing our tour of this beautiful dental office, and we're having conversation with the office manager, and got just a couple of questions for her. And our first one is, what aspect of the office does the staff seem to like the most?
I'm sure it's different from the front office and the clinical staff. One thing that everybody likes is the break room. It's huge. There's room for everybody, which was not the case of the old office. The clinical staff, especially the hygienists, have extra operatories so that they don't have to run late because they're waiting on the doctor who's gotten a little chatty with the patient that they're checking. They've got kind of an overflow room and they can get started on their next patient, so it allows them to stay on time, which is very nice. Let's see, front office, there's just so much more room. And the way the workstations are spread out is really nice. I've worked in several places where you're literally on top of each other, and you hear every word that everybody says, and this is just laid out very nicely where you've got some space, you can talk, you can hear yourself, you can hear the patient you're speaking with. The consult room is a nice feature as well when you're presenting large cases where you don't want to sit and have that conversation in front of anybody else, and the patient maybe is not as comfortable talking finances. It's nice to have a private space to take them and sit down.
As the office manager, does it allow you to solicit a higher quality of employee being in this kind of environment?
Very nice. There's a lot of space. I know I've interviewed people in here and been able to shut the door and have nice long conversations without people in and out. And I used to have to do interviews in the break room, which was very small. So, having a separate private office is very nice. And people who have come in and interviewed do comment on, I think everybody that I've ever talked to, such a beautiful office. This is so awesome. It's laid out so nicely. So,
how has the office affected patient flow? I was looking at your schedule. It's a lot of patients, a lot of hygiene patients, a lot of dental patients, and a lot coming and going. Every few minutes you have a new person walking in the door. And so the flow here is critical to not make it look crowded.
Right, and it doesn't look crowded at all.
So how has this office handled patient flow?
Our patient flow is very smooth. It's not congested at all. The way it's laid out, there's a separate space for everything. The patients check in one place. They're taken to the back. Very seldom are people even passing each other. The operatories, like I kind of mentioned with the hygiene having extra, it also helps to stay on time because they've got the rooms. Each doctor has 2 operatories. So it kind of, it's just never congested. The halls are wide. The x-ray area where it is out of the way. They're not having to take x-rays in the rooms. Just all in all, it's a great flow.
Finally, as a last question, what has been the reaction of new patients as they walk into the office?
I have never heard a negative thing from any of the patients who come in. We get comments about how beautiful the waiting room is, how large it is, how nice the restrooms are. It's really funny, the patients who actually were in our former office that remember it, that are just amazed at the difference. They just love it. The chairs are awesome in the back, and they get a massage.
So
It's just, I've never heard anything negative about the office itself.
excellent, excellent. So we have an office here that is consistent and congruent with the level of care that's being proposed to the patients and is actually being delivered by the staff, by the doctors, and by the hygienists. And I think if the dental profession embraces that concept and we're able to actually elevate the image of the profession so that we actually look like we can do what we say we can do, we're going to have a very, very bright future for all of us in the profession.